And we are now opening up the floor for questions. And dear colleagues, if you have a question, please raise your hand. And I will then give you the floor. And it would be really helpful if you would give us your name and also your affiliation. So far, yes, I have a question from Aina. Aina, perhaps you can tell us where you come from and ask your question.
So my name is Aina, and I work for Verificat, which is a Catalan fact-checking platform. And now we are writing an article about adverse effects in general, and we have observed that it may exist a difference between women and men. So I wanted to ask, what is your point of view on this, and like your experience on this topic? Thank you.
Thank you very much. Perhaps, Georgi, you want to respond to this, the difference between women and men. I think this is a rather general question and not very specific to COVID-19 vaccines, if I understand correctly. Georgi, please.
Yeah, thanks. I mean, it is, you might need to help me, guide me a little bit, because there are a number of different aspects, and a number of different events can have, different prevalence in men and women, or maybe you're talking about reporting number of ADRs. I don't know. You need to help me with that. So it depends very much on the ADR. So let's take myocarditis, for example. What we know for myocarditis, and there are different types of myocarditis, and then maybe interrupt me if I'm going totally in the wrong direction, but for myocarditis, which can be caused post-mRNA vaccination, but also post any viral infection, what we know is that more affected are men than women for both post-vaccination and post-viral infection, and mostly men in their late teens and early 20s. It's just a way, we don't know exactly why. There's some hypothesis linked to sex hormones having influencing this, but we don't know for sure. So that's one example where it is different for between men and women. Women are far less far less frequently would experience myocarditis, and that is classic myocarditis, viral, and post-mRNA. So that's one thing to say. Different ADRs might have different prevalences in the different sexes, male or female. It's not very common, but it exists, as the example I gave for myocarditis. But help me. So this is the first line. Before I go,
Georgi, before you continue, Aina has kind of clarified a little bit in the chat what she was also would like to know, because she says in her chat that women are reported to actually report more often, more frequently ADRs to overall than men. And can you comment on this, if I understand you correctly, Aina? Georgi, please.
I think generally speaking, you're right. Again, it will depend a little bit. I mean, there are many things to factor. So it depends on the condition that is being treated. You'll know that some diseases are more prevalent in women. Then clearly you'll expect more reports coming from female patients. But overall, I think your observation is correct. What we've seen in EUDRA-Vigilance, the reports, and if we focus on COVID-19 vaccines, we have more reports for female patients or vaccinees than for male. Now, what drives that? There could be a number of different explanations, and I don't think I can give you one specific reason. It may be that women report more often. That's probably the most plausible one. But there is a trend indeed. Then again, depends on the population. The ratio between male and female, overall vaccinated people. So there are many different aspects to consider. I don't think maybe that's a high-level response. Over.
Georgi, yes, and Aina is also asking whether you know about any existing research into this topic, the reporting difference between men and women. Do you know of any research that you could direct her to?
Not off top of my head. I mean, there's a lot of. I mean, I'm sure there will be people that have looked into it. We have not specifically. I think as regulators, what is important, apart from reporting rates, and I think that's important, is whenever we assess an ADR, we would look how to minimize the risk. So, are there any patients that are at higher risk? And this could be as high level as male are more prone to it, like in myocarditis, or female are more prone to it, or within male and female any specific characteristics that might indicate that that will be the case. But that is on the risks itself. On the reporting patterns, I mean, maybe we can take that offline. Off top of my head, I cannot direct you to any articles, but I'm sure there is observations out there. Over.
Thank you very much. I think if I read Aina correctly in the chat, she's fine with the response, and actually you kind of answered her question. I'm currently not seeing any additional questions. Colleagues, if you want to ask questions, that's now the time. Please raise your hand, because now you have the opportunity to get direct advice from our experts who can enlighten you on this quite difficult subject. But I don't see any additional questions. So I would like to close this meeting now. Many thanks for having participated today. As I said, you are really helping us to put the record straight, to make sure that the figures that we show, due to our transparency policy, we want to be transparent about, the figures we have, the evidence we assess. But we have witnessed quite often in the past that these figures were twisted and kind of put out there without any context. And therefore, they scared actually the public about COVID-19 vaccines. And you are helping us to kind of correct this and make sure that people receive accurate information. So as I said, we are going to share the slides with all people who registered for this webinar. We are also going to share with you a short survey that we would really appreciate if you could fill this in. And just before I close, I see that we have Ellen de Grave who still has a question. So Ellen, if you want to take the opportunity.
Yes, hi, thank you. I'm Ellen. I'm with DPA, Deutsche Presseagentur. I cover the Benelux, so Belgium and the Netherlands specifically. A theme that we just see continuously returning throughout the last year is specifically the COVID vaccines and pregnancy, and to a lesser extent also breastfeeding. And I know that current data shows that there is no adverse reaction when a pregnant woman gets vaccinated, and that is indeed encouraged. But I just wanted to ask if there is at the moment any further study being done on that, and do all the data still point to the fact that it is indeed quite safe and it wouldn't cause any abnormalities in the baby? Because just for example, right now I am working on a fact check where it's being claimed that a baby who has leukemia, like a very rare sort of leukemia, it's implied that the mother who is vaccinated is somehow responsible for this.
Many thanks, Ellen. This is a very important question, and I'm sure that Georgi can give you some insights. Georgi, please.
No, indeed. Thank you for the question. Vaccination in pregnancy is very, very important for very clear reasons. First, it provides protection to the mother. We know that pregnant women are at higher risk of serious outcome for COVID and also complication of the pregnancy due to COVID. So that clearly it's a very strong case for vaccinating pregnant women. As you rightly said, safety data does not, and we've collected quite a lot of information regarding to vaccination in pregnancy. It does not indicate any concern. So that's the second point to make. And we've also seen studies that indicate that in mothers who have had the full primary series, so 2 vaccinations, there is a protection for the infants up to 6 months because the antibodies are passing to the baby, protection from hospitalization and acute respiratory distress in babies that might be exposed to COVID. So protection for the mother, protection for the baby, certainly the infant up to 6 months, and no safety concerns that we have seen in pregnant women. Now, vastly pregnant women were vaccinated with mRNA vaccines. So that's, I have to say, that's where the bigger part of the information lies. So clearly, very important to get pregnant women vaccinated. And I don't have overview at hand, but it is very likely, and we see that in many jurisdictions, that because of concerns, a more sensitive approach by pregnant women, far less pregnant women than needed have been vaccinated. So thank you for the question. The other answer is no. So far from the data, again, to highlight, no safety concerns, but we monitor very closely. I mean, there are studies for the companies on pregnancy that we have imposed. We monitor very closely EudraVigilance and any other literature, and as well as EMA-funded studies for specific questions with regards to closely monitoring of pregnancy safety in pregnant women. So I'll stop here.
Thank you very much, Georgi. And as I now do not see any additional hand, again, thank you very much for participating today and for the interest in our work and our activities. And as I said before, for helping us to set the record straight. So thanks again and have a nice rest of the afternoon. Bye-bye.